Ladies and gentlemen, dear colleagues, greetings from Cyprus. My name is George Pamboridis. I'm the Minister of Health of the Republic of Cyprus, and I have the honor to chair this year's Commonwealth Health Ministers Meeting in Geneva on May 21st. This meeting is a unique platform for deliberating and sharing experiences and mutual learning as a way to accelerate the pace to meet the relevant target of Sustainable Development Goals, thus securing the highest standard of health to our population as a fundamental human right. On the eve of World Health Assembly, we are going to have the opportunity to discuss issues related to universal health coverage, global security and violence. As you know, universal health coverage is the center of gravity for all national efforts, notwithstanding the diversity of health needs of the different Commonwealth countries. As far as global security is concerned, experience has taught us that the global geographic spread of our countries implies the necessity of taking action jointly on cross-border risks to public health security, since domestic action alone has not proved to be sufficient in ensuring health on a local level. Along the same lines, the importance of violence prevention for public health security is indisputable. During this year's meeting, an innovative and challenging approach will be followed. Besides keynote addresses, regional presentations and reports, the work of the meeting will be broken up into 3 parallel sessions, with ministerial roundtables discussing each pillar in an interactive way and reporting back to the plenary. In the framework of the meeting's deliberations, we will have the opportunity to examine a variety of options for sustainable funding of universal health coverage, as well as to share country experiences of effective funding models. All Commonwealth governments have committed to take steps to accelerate universal health coverage, adapting WHO's definition. That is, to ensure that all people can use the promotive, preventive, curative, rehabilitative, and palliative health services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardship. Financial protection is a main principle in universal health coverage. Hence, the challenge of sustainable financing of universal health coverage to ensure services can be extended even to those least able to afford services. As the Minister of Health of Cyprus, I am going to have the opportunity to discuss the challenges and opportunities we have faced and still are facing in accomplishing my vision and target for a better health standard in my country. A healthier Cyprus with improved indicators in health equality, social inclusion, and citizens enjoying access to high-quality healthcare services while being protected against healthcare-associated financial hardship. In this framework, my efforts focus on making progress towards a system of universal health coverage based on solidarity, free choice of healthcare provider, and complementaries of public and private sectors. During the Commonwealth Ministers of Health meeting, we are also going to examine share pertinent experiences in addressing global security challenges and identifying effective ways to reduce all forms of violence, including family violence. There is growing recognition that universal health coverage is an essential component of our response to the challenges global security faces, as well as to how violence is addressed at the national level. Last but not least, allow me to congratulate the Commonwealth Secretary General and the Secretariat, of course, as well as the Commonwealth Advisory Committee on Health for the vast and hugely important work accomplished over the last year, as well as for preparing a rich and indeed condensed one-day program. It is going to be a pleasure to welcome you to the Commonwealth Health Ministers Meeting on the 21st of May 2017 at the Starling Geneva Hotel and Conference Center in Geneva. I trust that the meeting will meet all your expectations. Thank you very much.